Women's hormone replacement here at Plaza Aesthetics and Wellness, we use BHRT, which is bioidentical hormone replacement. Essentially what that means is we are replacing a woman's progesterone, estrogen, testosterone levels to normal levels. If they're feeling like their levels are low, if they're deficient, they're perimenopausal, menopausal, and they have symptoms associated with abnormal hormone levels. So we would want someone to maybe feel like their hormones when they were in their 20s and 30s. The average woman goes through menopause at the age of 51, but sometimes women will go through perimenopausal symptoms even in their late 30s, early 40s, or they may have a medical condition that causes their hormones to be very, very high or very, very low, which would be reason for them to come in for hormone replacement therapy. We currently are not providing hormone replacement for individuals that are transitioning, and that is more just my own in education. I always want to be on the forefront and have the best education and provide the best products and services for our patients, and I have not undergone training for our transgender patients. One procedure that we do a lot of is laser hair removal, and we have a lot of our patients that are possibly transitioning. That may be the first step that they've taken. It may be right after hormone, it may be before hormones, but we do often see transgender patients for laser hair removal. We're just not currently seeing them for hormone replacement therapy. So hormone replacement absolutely is a tailored process. We would start by a complimentary consultation and then obtaining baseline labs. Usually we start with serum lab testing, but we can also do urinary testing or salivary testing. And then we would determine based off of symptoms and then based off of laboratory values if it was an appropriate treatment for patients. There's many routes that you can get hormone replacement through, most commonly transdermal or intramuscular. There's also a troche, which is an oral route, but everything that we're doing is bioidentical and essentially mimics what would be natural in the body. So the complimentary consultation is very important to be able to determine the appropriate dose for patients. It's often smart to start low and go slow, but a patient, sometimes they're transferred to me and they want to move from a previous provider to myself, and then sometimes we have to decide, okay, what is, if someone's on something transdermally and then we're moving to oral, what is the equivalent from one to the other? But it's really frequent monitoring to let them know the adverse symptoms and know that, you know, we're available by phone, that they can call us, and we can always do a follow-up appointment to see if we need to adjust things. One of the reasons in women I primarily recommend a transdermal route is you can start with an estrogen cream separate from a testosterone cream separate from a progesterone, either cream or orally separate, and then once they're at a stable rate, then you can combine everything into one preparation. But women are very difficult when it comes to hormones, and there's a lot of symptoms, and you don't want them to end in a divorce. So you want to make sure that things are going very, very slowly, and if they do have any adverse event, that you're able to make quick changes.